Hi everyone, Dr. Brian Steiner here at Wilkins Spinal Care. This week we're going to talk about something that is very essential to our practice and that we've helped many patients with. This week's blog was on diabetic neuropathy. So what I'm going to talk about today is what diabetes are and what diabetic neuropathy is. Now, if you've read this week's blog that I sent via email or Facebook, it is very long. I'm not going to go through the whole entire blog itself. There's a lot of content in there, exactly what diabetes is, how it's diagnosed, stuff like that. I'm just going to give a real brief synopsis of what diabetes is and what diabetic neuropathy is and how we treat it. So let's dive in first and discuss what diabetes is. Diabetes is a condition when our body's not producing enough insulin. Insulin is produced in our organ called the pancreas. Whenever our body doesn't produce enough insulin, we have higher blood sugar levels. That's the goal of insulin. We eat something, and then insulin comes in and manages our blood sugar level. Whenever there's not enough insulin that's being produced, there's this blood sugar that just sits in your body, and that's what produces fat, and that's what produces the diabetes. So if you looked at our blog, there's 3 different types of diabetes. There's type 1 diabetes, type 2 diabetes, and something called gestational diabetes. So type 1 diabetes is about 5 to 10% of Americans. That type 1 diabetic, that is someone who, it's an autoimmune disorder. It's someone who they're typically born with it. Type 1 diabetes, this patient has to be on an insulin pump at all times. 2 different causes of type 1 diabetes. One, it's usually due at birth. Second thing with type 1 diabetes is it can happen after having type 2 diabetes. If someone who has type 2 diabetes doesn't manage themselves, they can end up in type 1 diabetes. These patients produce almost no insulin or very little of it where they need that insulin pump. Type 2 diabetes is a lot more common, and it makes up about 90 to 95% of Americans. These are patients who are typically overweight, don't have a proper diet, eat foods high in sugar, they don't exercise. These people are the patients that they can manage it and then just choose not to. And I'm not trying to bash anybody or anything. It is a very common disorder. It's actually the 4th most common cause of death in America today. Over 37 million Americans have type 2 diabetes. How do you manage these types of cases in type 1 and type 2 cases? Type 1, yes, they need the insulin pump. There's just no way of controlling that. They need it. Type 2 diabetics. These patients can live a normal life, okay, with proper diet, proper nutrition. Yes, take the medications that you are given. However, there are type 2 diabetics that don't need these because they eat properly, they exercise properly. So you can live a normal life with type 2 diabetes. It's not curable, but it is manageable to the point where you may not even notice it. Now, the 3rd type of diabetes, this one's more uncommon, but it's called gestational diabetes. In gestational diabetes, it's when a mother is pregnant. Sometimes mothers will develop diabetes, but once they've delivered, it typically goes away. However, sometimes in gestational diabetes, since that has occurred, sometimes later in life they can end up with type 2 diabetes, but it's not always a guarantee. So those are the different types of diabetes, and that's how you manage them. How do you know you have diabetes? Blood work. That's the biggest thing. They're going to check your A1C, they're going to check your fasting blood sugar levels, and if they're at the recommendation or at the high levels that they say gives diabetes, that's how they confirm it. They 2 tests to confirm it. It's all the numbers are in the blog. You can go ahead and take a look at that. But what I want to go into next is diabetic neuropathy. Now, with diabetes comes complications, vision problems, heart problems, breathing problems, overweight. Big one, though, is diabetic neuropathy, which is neuropathy. And we've discussed neuropathy several times in several different blogs. What is neuropathy? Real quick synopsis. Neuropathy is when nerves are essentially dying. And you can have mononeuropathy or polyneuropathy. Mononeuropathy is when it affects one single nerve. Polyneuropathy is when it affects 2 or more nerves. Typically in neuropathy, or diabetic neuropathy for that matter, typically it's a polyneuropathy. A mononeuropathy is a lot more rare. Typically in patients with diabetic neuropathy, the most common area that is affected is their feet. And if you've ever noticed or you've ever heard stories, a lot of diabetics lose their big toe. Yes, that is a very true thing. It's very common. Why do they lose their big toe? Whenever somebody has diabetes, whenever somebody has neuropathy, they start to lose circulation to their blood flow. Why the toe over anything else though? Because the toe is the furthest organ or furthest body part away from the heart. So the furthest points are where the blood is restricted most. There's going to be more blood in the arms and hands because they're closer to the heart. So whenever somebody loses their toe, it's because they're not getting enough blood flow and it basically dies. So they have to cut it off. So those things can be prevented, and that's because of neuropathy. Now, how is neuropathy treated? Again, these are things that we've discussed in past blogs, but I'll go through it again. Neuropathy, typically doctors will give you a drug called Neurontin or gabapentin. And again, those things are numbing the pain. They're not actually fixing the problem. Neuropathy is one of the most common things on this planet, and it is one of the most frustrating disorders because people live with it every single day. It can be managed without medications. Again, they're just masking the problem. They're not actually fixing the problem. If you notice to my left here, there's a machine here. That will fix the problem. This is something called our Hockamed therapy. And again, this is stuff we've discussed in the past. The correct term for it is called horizontal therapy. Our body has pumps allowing for sodium, potassium, calcium, a couple different essential elements to our body that help our nerves survive. Whenever those sodium pumps, potassium, chloride, calcium, whenever they all start to malfunction and they all stop working, that's when nerves die. That's what this machine does. It regenerates those pumps, allowing sodium to be pumped back in, potassium, calcium, and allows the nerve to continue to survive or basically be reborn again. And this is something we've been doing in our office now for about 10 years or so. It works really well. I'm not going to show you exactly how it goes on, but we have pads here like you would get on a TENS unit, okay? And what we typically do in a neuropathy patient, we set it to the neuropathy program, and we place a pad on the hands, and then typically either the bottom of the feet or the back of the legs, depending on where the patient's symptoms are. Most neuropathy patients are in their feet, but some patients don't have problems in their feet, so we put them on their leg, or some people have problems in their hands, so we just do their leg and their feet. So what it does is, if you've ever been on a TENS unit, typically you want a muscle to contract. Here you don't. If you feel a muscle contraction on the machine, that tells it's too high and it's not going to get into those pumps that are essential. What you want to feel is a slight tingle or almost like a slight numbness. That's what will wake up those sodium pumps, potassium pumps, and allow those nerves to regenerate. Again, just like our decompression program, it is a neuropathy program. You know, some patients need 10 visits, some people need 20 visits, some need 30, some need 50. It just depends on every case. And most of the patients that we see here need anywhere between 20 and 30 visits. The longer you wait, the worse it gets, and the longer it takes us to take care of it. So if you or anyone you know has neuropathy, get them in here. We have tests that specifically will test to confirm if they have a mild neuropathy, moderate neuropathy, severe neuropathy. And if they do, this is something that they want to take advantage of. It's a very, very successful option for you. It's painless and it's comfortable. It's a 45-minute treatment. We have people that can read books. You can take a nap. Some people bring their own puzzles. It is a very relaxing program, but it is a very successful program. So that's what I have for you guys today. Next week, I'm going to kind of go into more of a nutrition type of an aspect, which may further help me continue into diabetes if we have any more questions on diabetes. But if you have any questions before then, feel free to reach out to me. I'll be happy to answer any questions for you. Enjoy our rest of our beautiful day. Bundle up. It's supposed to be cold this week, and we'll see you in next week's blog.